Many thanks for staying with us here on the Morning Rush. Welcome back from that break. It's time for us to talk. And of course, on Thursdays, we do some health talk with Dr. Prince Osei from Menopause. And today, we're talking about some myths that you have, or all of us, we have about fibroid. What have you heard about it? I want you to share with us here. So you can WhatsApp us on our line 0553 000035 0553 000035. What are the conceptions or the misconceptions that we know about fibroid? He's going to share that with us. By the myths also, whatever that you want to ask, you can share that with us. And Dr. Prince Osei will be answering all of that. So let's get into it. Dr. Prince Osei.
Let's see.
What's good?
Cool.
Okay. I know you are not actually good because your team is not in a good shape.
No comments.
Real Madrid. But anyway, good to see you once again.
Great,
so today we are talking about the myths about fibroid. My first, let me start with mine. What I heard about fibroid is if you have fibroid, you can't give birth.
It's not true.
It's not true.
It's not true.
Okay.
Yeah. So fibroid mostly is always in women. Men don't have fibroid. So, yeah. So it's an abnormal growth in the uterus. And sometimes depending on the size and the location, mostly that is what we use to determine whether someone with fibroid will be able to have children or not. So depending on the size, sometimes the size is so big that there will have to be something that we call myomectomy. That's the removal of the fibroid. Okay. But sometimes they are just small growth within the uterus, which wouldn't really disturb you when you want to have children. Actually, there are some people who they may have fibroid, but they wouldn't even know. They will have their children and they would not even notice that they have some fibroid. Yeah, so fibroid is not a death sentence. When you are diagnosed of it, it doesn't mean that entirely you wouldn't be able to have children. You can still have children once you have it. Yeah.
Does it only affect women in their 30s and 40s?
No, it affects women in their reproductive years. So the reproductive years is from when you start menstruating. Okay. So when you reach menopause. Even research shows that after menopause, sometimes it goes on its own. So it's believed that it's the female hormones, the ones that makes you a lady, the ones that makes you be able to conceive and all that. Okay. That is when there is abnormal production of the hormones, it could lead to the growth of the fibroids. Yeah, so women in their reproductive years are mostly likely to have fibroids. So it can be as early as 20, 25 years, you could have fibroids if there are hormonal imbalance within your system. So it's not only for women more than 30 years, but it's mostly seen around that time because the more the uterus is there and there is no baby passing through, like if you're not conceiving early and all that, then it could mean that fibroids could develop within the uterus. Mostly, some time passed, when we talk of fibroids, we used to attribute it to people who are aged and all that. Yeah, because those times, women were giving birth earlier, so you wouldn't be able to notice that they have these conditions. Yeah, but of late it's not like that. So we have a lot of women coming up with these fibroids. Yeah, so that is what
it is. And some also have heavy menstrual flow and painful ones. Yeah. And some have like the normal ones. Some even is perceived that they exceed the 7 days and 8 days. And they said that if you have fibroid, the blood comes in excess. Yes,
it depends on the type of fibroid that you have. Okay. So when I'm talking about the types, we have something that we call subserosal fibroid. That one is outside the uterus, and we have submucosal. That one is within.
This one you hear, submucosal.
Submucosal, yeah. So we have some images on our screen. The subserosal is the one outside the lining of the uterus. So you could see that there is one, those yellowish, is it yellow? Or,
sort of curry.
Yeah. You see the one on your, is it right?
My right? The one standing on its own.
Yes, that's the subserosal fibroid. Those ones are outside the uterus. The submucosal one, you could see that within the cavity That's is it the
V
triangle? Yeah. There is something on the top there.
There.
That one is within the uterine cavity.
Okay.
So that vein shape is the uterine cavity.
Okay.
So the whole thing is the uterus, the fallopian tubes, and the eggs are, and the vaginal opening is down there. So that vein shape, that is where babies are formed. So when there is fertilization, the baby come within that cavity. So that cavity where you have that thing up there, that is where we have the submucosal fibroids, and we have intramural fibroids. So the ones within the uterine lining, so the one on your left, you see, is in between the inner lining and the outer lining. Those ones are the intramural fibroids. So, and we can have pedunculated fibroids. This image didn't show that. We have pedunculated fibroids. Those are like you see when there is pawpaw. It comes with some stalk, and the fruit is on it. Some stalk. So that is how the pedunculated fibroids looks like. It has that stalks that attach to the uterus, and you have the fibroid itself protruding out there. So those are the types of the fibroids. So depending on the type, it could lead you to bleed more, or you may not even have bleeding issues at all. So mostly the submucosal ones will cause you to bleed, because when the uterus is contracting, it could cause the fibroid to also bleed in excess. So you have abnormal menstrual bleeding. Sometimes the normal days that it should be, as you mentioned, mostly the bleeding shouldn't be more than 7 days when you are menstruating. But if you have it, there are people who come to the hospital, they'll bleed for like 2 weeks, 3 weeks. Even yesterday, there was a case I saw. She's been bleeding for 3 months. So, 3 months, continuous. And it happens like that. There are some women who have those conditions. They'll bleed continuous for like some months. It will go off for some few, let's say 1 month or 2 months, then it will start again. So fibroid could cause all these menstrual issues. So that is it.
Okay.
Interesting.
Wow.
But as you are at the hospital and you engage people, what do they think? What is their thoughts about fibroids? At what time do they rush and say they think they have fibroids? Or
mostly they will come when they are trying to conceive and it's not coming. So it's something that we always advocate, that we need to be checking ourselves from day in, day out. Once you are within your reproductive years, you should know that these things could happen. So you need to be checking regularly at the hospital. But they mostly come in when probably they are trying to conceive and it's not coming. By then, the fibroid might have grown so much that it might be a bit difficult to manage, or sometimes they may have to undergo surgery and all that. Fibroids, when they are not so big, when they are not, the sizes are not so big, there are some medications that could prevent it from further growing. There are some even that can reduce the sizes for you to be able to conceive and all that. But if you delay or you stay in the house for a very long time, it makes the treatment difficult. And that will lead to the surgery and other things that sometimes some of the women goes through.
And if you leave it untreated, will it continue to grow?
Yes, it will definitely grow. It is believed that it's the female hormones, as I mentioned earlier, the estrogen that feeds on the fibroid. So, as I mentioned, it's an abnormal growth, and we should know that it's not a blood clot. There are some people who think that if the menses is not coming as it should, some of the menses will form clots within it, and it will cause the fibroid. But it's just some abnormal growth. You know, when the uterus is, when you are young, the uterus too is small, but as you are aging, it begins to increase in size and all that. But it sometimes gets to a point that these fibroids grow abnormally on the uterus, as we saw on the image. It can grow within the fibroid or outside the fibroid, the uterine lining, and it can cause a lot of problems. So it's not the blood clot that is causing the fibroid, but it's just the uterus that is overgrowing. So if you leave it untreated, it will continue to grow, and as it grows too, it can. There are some women that they will come, the fibroid has taken all over the uterus, and we have to do something that we call hysterectomy. That's the complete removal of the uterus and everything. because the fibroid has gone,
occupied everywhere.
and we
So
can't
to
just
take the
take,
whole-
and we can't just take the fibroid out. We have to take everything out. Yeah, so it's something that.
Yes, it's black.
Interesting. So let's have the data with respect to the age ranges.
Yeah.
Is it like 20 to 30?
Yeah, I mentioned that the reproductive years. So
the reproductive years.
So the reproductive years.
anyone at all within the reproductive years could get fibroid. Anyone at all, irrespective of the age.
Hey.
Yeah.
So the moment you start menstruation,
it means you are at risk
of
getting it. Yeah, it means that the hormones have now started. You know, when children are young, these hormones haven't started their work. So once you reach the adolescent age, the testosterone starts working for men, the estrogen, the follicle stimulating hormones, other things start working for the women. So once you hit that age, it means that you are at risk of getting it because it's those hormones that may produce to cause these abnormal growth within the uterus. Yeah, so any lady within the reproductive years, you should at least check once a year to find out if there is something
we haven't checked yet.
going on. You know,
if there's something there.
Yeah, it's good to know it earlier because, as I mentioned earlier, when they are small, like the fibroids are small, so we use centimeters to measure. So mostly, if it's less than like 3 centimeters, there are medications, especially when you come to Menopause, there are medications that we can give to prevent it from further growing. It could prevent your fertility, then we give some medications to boost your fertility to be able to conceive. Yeah. So
Doc, finally, before you go, as you are talking about within the reproductive age, you are at risk. Now, when you move out of it, that is your menopause.
Yeah.
The womb is also empty. There's no menstruation.
Yeah.
Does it?
So when you reach your menopause, even when you've been diagnosed with fibroid around age 49, getting to the menopause age, most doctors wouldn't do anything about it because when you hit your menopause, the hormones, those estrogen and other things, they don't produce.
They don't produce anymore.
Yeah, naturally the fibroid will shrink on its own unless it starts giving you problem even within menopause. If you start having abnormal bleedings and all that, that is when you may need some treatment. But if it's not causing any problem and you hit your menopause, there is no need to worry. It will go on. Naturally, the uterus even shrinks when you reach menopause. It's the size of the uterus actually shrinks. So if there is anything within the uterus it will be able to deal with. Yeah. So and ladies should take advantage of this Menopause.
Yes,
we are having
go for free.
Yeah, that was why I wanted us to talk about this. A lot of women, when they hear of fibroid, they get scared and all that. But Menopause have made it easier for people to get screened. And if there is any complications, there are medications that could manage it depending on the size. We should take note of it. It depends on the size. So when you come and get checked, and maybe there are some nodules developing and all that, we will be able to give you medications or advise you according to what to do. So coming Monday, 1st of May, all Menopause branches, all the branches at Adenta, AESL building at Accra Central,
behind the school for the deaf,
and Kumasi and Kokove. We are having this free screening. For women, we are screening mostly for fibroids. For men, for the prostates. We have dental screening at Adenta and in Kumasi. There will be dental screening
I will be there.
Yeah, but the other centers don't have.
They don't have the dental.
Yeah, so that's just for fibroids.
Yeah, for the dental, it's just Adenta and Kumasi. But all the other branches, you could get the fibroid check, you could get a prostate check.
But our health is our world. So even if you have to pay something, move to Adenta to check your fibroid. Your
so people are advocating for Adenta.
So please, if you're an Osei man, if you are in my area also,
check your teeth.
So they all have to come to
Adenta. If kids will be able to see the other Adenta, is good. I'll be there. I'm telling you. Come and check your teeth. Our teeth, like, I don't remember the last time I checked my teeth, but this free screening.
I remember you.
Oh mine. I will check.
Yeah.
Anyway,
you should come.
Yeah.
Come and let's go to Adenta.
I know why I should come.
You know. Now I know why it's very in a shaman.
Anyway, guys, let's just appreciate Dr. Prince Osei for coming in.
Yeah.
Of course, get onto the Menopause branches across the country and go check them. There's female cure, all of those things. But of course, Monday is a very important one. Free, F-R-E-E. We all like free stuff. So just get out there and go check your health. It's very important also. That's it. Yeah. Look, thank you for coming.
Thank you.
As always.
Yeah.
Wish Real Madrid well.